Hey, we're the Turd Nerds. We're glad you're here. Before we take the plunge, let us introduce ourselves. I'm Dr. Rebecca Sand, a naturopathic physician and licensed acupuncturist specializing in digestive, microbiome, and hormone conditions and integrative fertility.
I'm Dr. Ami Kapadia. I'm a medical doctor trained in family medicine and functional medicine with a special interest in combining standard therapies with lifestyle and nutrition-based interventions.
And I'm Dr. Alana Gurvich, a naturopathic physician, licensed acupuncturist, and a fellow of the American Board of Naturopathic Gastroenterology. I specialize in IBD, IBS, and other functional GI disorders. Let's dive in.
The following discussion is for educational purposes only and not intended to diagnose or treat any diseases or conditions. Please consult your doctor before incorporating any of this information into your care. The information presented on this podcast is not medical advice.
All right, welcome back, everyone. We are here today with Dr. Sand doing part 2 of our Gallbladder Series. I believe this one's on gallbladder and the hormones.
That's
after
right.
that last episode of very confusing information on multiple other gallbladder problems.
That's right. Gallbladder and the microbiome, perhaps.
It definitely wasn't
That one-
simple.
No,
That's why I'm doing this deep dive, is to try to parse apart this little organ that we take out in so many people, but like what's
700,000 a year.
Yeah, what's going on here? So the point I want to make in this episode is that your gallbladder is a hormone organ.
Ooh, controversial.
Controversial, except it's not, because it's a
Except it's not.
fact. Yeah. So gallbladder, estrogen specifically, a little bit about progesterone, and we'll get into the microbiome because I can't help myself with that. So I have personally, what prompted this is I've been getting so many perimenopausal patients, which I love. I love perimenopause.
You do.
And I've been getting a lot of gallbladder people, and I was like, what the heck is going on here? So obviously we know there's a correlation. We know the Fs that we kind of covered last time.
Female, fertile, 40.
Yeah.
Yep.
And let's dive into why. So quick recap on gallbladder function. Anybody want to talk about what the gallbladder does here?
Stores bile, releases bile in a
Rhythmically.
rhythmic fashion, depending on when you eat.
Yeah. And specifically when we eat fat, we make something called cholecystokinin that triggers the gallbladder to put some bile into our intestine to digest it. And if you want a deeper dive on like what the heck happens here with the primary bile acid salts, secondary bile acid salts, listen to our first episode on this, because it's fascinating and it's really important for people who have gallbladder issues that are constipated, because we don't think a lot.
And you might need to listen to it 5 times.
On half speed.
I might go back and listen.
On half speed.
Yeah, there's a lot. So, okay. Let's understand estrogen's relationship to the gallbladder, and it requires a 3-part framework here that I kind of alluded to in our last episode. So at physiologic levels, estrogen is protective for the gallbladder.
Okay.
It's protective. It helps our bile system stay healthy, and it also serves some functions. When it's in excess or in fluctuating states, so when might that be?
Perimenopause.
Estrogen's getting crazy, pregnancy, adding hormones to the system. Yep. Combined oral contraceptives. It becomes lithogenic.
Ooh, that's a good
Stone
word.
forming.
Yes.
Stone forming.
It's not good.
Right. So when it's high, abnormally, that's when we start to form stones, even if it's bioidentical and high.
But you said less with patches than oral.
Right, because of that first pass metabolism that we'll get to here and its impact on the liver. So in deficiency, it withdraws its support.
Whoa.
So
that makes
estrogen
sense.
does protect. It's just if we take it away, we lose that protection. So that really was a lot for me to parse apart, and I'm going to give you all the details on that here. So how estrogen normally supports the gallbladder. This is sort of our baseline information. There are 4 things I want to give specifics on. So 1, estrogen in healthy amounts. I shouldn't say in healthy amounts. Estrogen in our cycling years, if it's regulated and within the normal range for people, stimulates bile acid synthesis. So physiologic estrogen upregulates the 7-alpha hydroxylase, the rate-limiting step in bile acid synthesis, increasing conversion of cholesterol to bile salts in the liver. This maintains our bile acid pool. We need that. We know we need that. It also, though, works on our contractility. So estrogen, we actually have smooth muscle in our gallbladder that has estrogen receptors. So this is really important, and that's a main reason that if estrogen goes too high or too low, the contractility changes in our gallbladder. I mean, you can think if that gets diminished, we start to pool and maybe start to form stones. So it's a whole other mechanism. Okay, and then we've got our antioxidant protection, which we talked about in the first episode here. So estrogen provides direct antioxidant defense for the biliary epithelium, not just the gallbladder. So have this on your radar for people who have their gallbladder removed. They go through menopause, that estrogen, they're losing that antioxidant protection for the biliary system.
Whoa. Okay. That sucks.
Yeah.
Yeah.
And we can help it. There's stuff we can do. It just, we don't have it on our
So
radar.
you mean they might be more prone to post-cholecystectomy symptoms?
Yes.
Okay. You got to spell it out for some of us, Rebecca.
Yes, that's exactly right. This is why it's a conversation. Yeah. And then lastly, estrogen supports microbiome balance. So estrogen supports Lactobacillus dominance. We see this in the vulvar and vaginal tissues too. This is why a lot of the time in menopause or postpartum, when we have no estrogen, we give vaginal and vulvar estradiol creams or suppositories or whatever. Estrogen feeds Lactobacillus.
Yeah. Huh.
So huge for our microbiome as well. And if you want more info about the microbiome and the gallbladder, tune into that other episode where we do that deep dive. So now let's talk about the paradox of why both high and low estrogen states reduce bile acid synthesis. Because this gets this tiered thing gets a little bit confusing.
A lot of attention.
Yeah. Chime in if you have questions. But this was fascinating to me. So this is one of the most counterintuitive findings, in my opinion, that both excessive estrogen and estrogen deficiency lead to reduced bile acid synthesis and increased gallbladder risk for people. So we talked all about the sort of different levels here, but in supraphysiologic excess, so we pregnancy, birth control, perimenopause, oral perimenopause spikes, I want to be specific, and oral HRT, we suppress this enzyme. And what happens is we get this negative feedback loop that decreases bile acid synthesis. So it's like too much, overwhelming the system. It tells the body, hey, slow down. We don't need this anymore. Right. And in perimenopause, when we're going really high, really low, really high, really low, that makes people feel like they're losing their mind. Hot flashes, night sweats, all of that. We're also going to see bile acid production, high and low, high and low, high and low.
Wow.
So it can lead to like maybe around PMS, these things get worse, but your cycles are erratic. So it's one thing to be looking at. And we're also going to see an increase in lithogenic stony bile for these people. Bummer.
Yeah.
But like we should have this on our radar.
Yeah, for sure.
In estrogen deficiency, so obviously perimenopause, postpartum, but also premature ovarian insufficiency folks, people who've had their ovaries taken out, oophorectomies, what we're going to see is that it removes that positive stimulus on this enzyme. So we reduce bile acid synthesis, and we also, because we're not binding as much estrogen to the smooth muscle, we're going to see loss of that smooth muscle support to the gallbladder. So that's contractility. We get biliary stasis.
Yep.
And this may be an argument for adding estrogen in some folks if they are having biliary stasis, their gallbladder just is pooling, maybe adding estrogen to bind to those receptors.
I have a multitude of patients who I waited to put them on HRT.
Oh, yeah.
Like they weren't super symptomatic and we weren't sure if it was going to make a difference, but their gallstones are like atrocious. And so I should have probably been thinking about this pathway. I didn't even know about it.
That's exactly why
if it was still going up and down, we could make it worse with starting the HRT earlier.
Well, HRT can actually help to stabilize those peaks and valleys. Yeah, because it's really in perimenopause, it's the peaks. So sometimes it's not a cumulative effect, which is kind of confusing because, again, there's another feedback with our estrogen and our ovaries. Adding a little bit more in, especially higher doses, sometimes kind of suppresses the high spikes.
Like it suppresses the physiologic spike?
Yeah, and it's not an exact science, and it's hard.
Yeah.
Yeah, and it is definitely a little bit of your theory, you have theories and you're playing.
Yeah, because we know for people who take estrogen or use estrogen too early in perimenopause, it feels awful.
Yeah.
It feels so bad.
You kind of have to find the right
time.
Yeah.
Timing.
And this is not scientific at all.
Yeah.
But one thing I am kind of experimenting with is, a maca. And there's a particular brand of maca that a lot of us use. That works really well for a lot of people in early perimenopause. Yeah. There's then a point it stops working. And that's around the time I want to have a discussion about estrogen.
With all of the things?
Perimenopause symptoms. Yeah. It doesn't fix everything.
Right.
It's adaptogenic.
And some people it doesn't work at all, but it can kind of help with those like creeping into perimenopause.
Yeah.
But then it plateaus.
Is it agreed upon that adding the estrogen helps prevent the physiologic spikes? Because I do see most
in some
of the specialists just put people on both. They don't do the progesterone first and estrogen.
Right.
Like, which is what had made more sense to.
I think that also makes more sense to me.
There
just
isn't an
my-
exact protocol, which is why it's confusing.
Okay.
So some people feel terrible on just progesterone.
Yeah.
Cyclic progesterone is generally a win for symptoms, but impossible to do for a lot of folks.
Yeah.
And if it's helping with sleep, then half the month you're not sleeping. And so, and then sometimes people just get really bloated.
Yeah.
And don't feel
also
good.
just want to say that these conversations, this is cutting edge medicine. Like, we're just taking physiology and trying to apply it to patients, not based on any big randomized controlled trials. Like, we're just looking at how the body works and trying to replace it. That is cutting edge precision
But
medicine.
I guess what I'm saying is like the women's health GYN specialists, they put people on estrogen and progesterone. It's more of a, I think, naturopathic approach to do it sequentially. Is that accurate?
Yes.
I'm seeing them do it.
You are?
I'm
Okay.
definitely seeing them do it. And I'm seeing people use progesterone more for like endometriosis and PMDD and other conditions
I
like
am
that.
seeing women on OCPs until they're 50 and then sometimes getting changed into an HRT oral.
I think in Portland,
oral still?
I think in Portland we might be in a special bubble where
Could be.
people are thinking outside the box on that. But I mean, I definitely see progesterone being, it's definitely not common. It's just, I'm seeing it. I guess I should.
Okay. Well,
clarify.
your tip, Rebecca, of the low dose progesterone was amazingly helpful. And I think that's more of a naturopathic thing.
Yeah, for sure.
Okay.
And creams and stuff like that, which we'll get to, because progesterone affects the gallbladder too.
Okay. Sorry. Go on.
It's a hormone, and the gallbladder we now know is a hormone organ.
Yep. Okay. So where was I here? Estrogen's role in deficiency. So we talked about that. So let's go a little bit more into these high estrogen states, and why perimenopause carries a distinct gallbladder risk profile, especially different from other states that are elevated like pregnancy. And it comes back to that kind of a fluctuation piece. So perimenopause specifically, we get that fluctuating rather than consistently high estrogen. Overall, what you're going to see here is delayed gallbladder emptying, impaired motility.
Oh,
without necessarily the stones. The stones come from consistently high.
Okay, and this is motility of the gallbladder?
Yeah.
Okay.
Of bile?
Yeah.
Okay.
Bile excretion.
Yeah.
Okay.
So it's like we've got the high states, the low states, but I also want to chunk out that perimenopause is like a whole different state because of the fluctuations. So it's really going to be motility. So when we're thinking about ways to support this, and we'll get to that, we really want to be thinking in perimenopause about supporting movement of the gallbladder.
Or movement in general?
Yeah. Movement in general. Yes. Yeah. Okay. Low estrogen states, just to kind of recap here, we see biliary stasis, higher gallstone formation risk, and loss of that antioxidant protection. So it's like this big cluster issue for people. It's just sometimes we bounce around. So, and then I also would like to say that estrogen loss menopausally or other states alters the gut microbiome in specific clinically relevant ways, not just generally. So we have identifiable strain changes that happen here. So lactobacillus, we talked about that. We know that for sure. We want to be considering in menopause supplementing with lactobacillus strains.
This is the
or eating yogurt.
Yeah, exactly.
Yogurt.
Yogurt
Eating
is better.
I like it and food better. Yep.
Well, we know you love yogurt.
Yeah.
And
I love yogurt.
She puts it on fried rice.
You know what though? I put it on everything. My oldest kid stopped liking yogurt.
Oh no!
I know. It was like a little heartbreak for me.
I am gonna burst your bubble.
Uh-oh.
As your kid gets older, everything that they liked just out of nowhere, it's like the light switch goes off and they stop eating it. And then you're like,
Oh, no.
what the hell? What are my strategies?
She
I have
still
none.
likes butter.
Give it time.
Maybe you just need to get her some different yogurt varieties.
How will I know she's my
Different
kid?
colors.
Yeah, different colors.
Something,
Yeah. Different spoon, perhaps. Bifidobacterium also goes down. This is important for short chain fatty acid production and colon cancer prevention and all of that. So that's a huge one. And then Akkermansia mucinophilia, which is fascinating. It's getting a lot of traction right now. I think Halle Berry is now the face of Akkermansia.
Oh, really?
Yeah.
Oh, interesting.
I know. I just saw that the other day. I was like, interesting.
Because she has alopecia? Because of her alopecia?
I have
Is
no
that
idea.
Halle Berry?
No, I don't.
Jada Pinkett Smith.
Yeah, someone else.
Yeah, sorry.
Yeah. So I am fascinated. I'm using. I got to do a presentation on PCOS here. It's just like
you've been saying that for years.
I know.
The data
You do need to
keep
do
coming
one.
out, and I'm just like, so the latest thing is Akkermansia.
Huh. Okay.
And PCOS just got a name change.
Oh, yes, it did.
Oh.
It did. PMOS, right? PMOS.
Why do they keep doing this?
That one actually makes
That one
very good
needed to
sense.
happen.
Oh, because you don't have to have the multiple cysts.
So it's polyendocrine.
Okay.
Yeah, metabolic ovarian.
And you need
So
to
what
have
is
the
it called
metabolic
now?
in there.
What-
PMOS.
PMOS?
I don't know. That's how I'm going to pronounce it.
Like
It's
methyl D?
Yeah. I mean, again, you're putting the change puts the metabolic aspect front and center, which is the most important part of it, but we weren't paying attention to it because it wasn't in the name.
Yeah,
it's the metabolic aspect that's the problem.
Or I don't even have the right name for the fatty liver. It's called metabolic associated.
Yeah, I have it in this presentation, so we'll get there.
Can we just call it fatty liver still? Okay,
I think
sorry,
what people, yeah, I mean, it is in there. I think what people don't understand is that Akkermansia has a huge link to metabolism. So Akkermansia is one thing we can be using to lower DHEA, which is notoriously hard to lower and can drive PMOS for a lot of people.
You're calling it PMOS?
That's the name.
You're not making it into one word.
Oh, no.
Okay.
No,
My sister in the UK would say PCOS. That's how they call it in the UK for PCOS.
Really?
So I'm going to go PMOS.
Okay.
I really like it.
Yeah, I always said PCOS.
I don't like it.
Try to make it a thing.
That doesn't sound good at all. Okay,
We're in a debate here. Yeah. And then we also see Faecalibacterium presnitzii go down, which is one of the most potent anti-inflammatory bugs we have in our gut.
You know, Akkermansia for me is a little bit tricky because I see the data, I see everything it supports, I understand its physiology.
Right.
I do not see supplementing with Akkermansia very effective.
I mean, the data about probiotics is always amazing and robust and exciting and life-changing, but it's like our bodies are so much more complicated than that. So I'm glad we're learning about Akkermansia because I think it's a key player. And yes, supplementing with its solo.
Maybe you need to start injecting that too.
I mean, it needs to go in orally. I'm all about injecting things. That is not my limitation.
But these bugs were not supposed to be standalone.
Right.
That's part of the picture. It's like we have to.
But isn't that one supposed to change the rest of the army or whatever?
They all were.
That is what they say.
Yeah.
And that is not what I see.
Out.
It doesn't play out.
And also, if you have this setup of your gut to not foster the growth of Akkermansia, you can pop it all day. It's not going to do anything. So
right. And that's where the food. And the polyphenols.
Yeah.
Akkermansia loves polyphenols.
We also, in menopause with the microbiome, see an increase in Privitella.
Okay, that makes sense.
Shigella.
Oh, you mentioned all these last time too.
Exactly.
These are the same ones.
Right. So those were microbiome changes associated with gallbladder dysfunction. This is specifically now if we drop our estrogen. So it's a double whammy for people in menopause. Poor women, but also let's pay attention now. Let's actually support women in menopause and not just say, well, you're menopausal. Of course you feel like crap. Like maybe let's do something about it. So are you saying
that just giving them a patch and an oral is not supporting them? We need to do more?
It is supporting them. And yes.
Yeah.
Yes. Yeah. Okay, so the net result is a bunch of things. The decrease in the conversion because of the microbiome and our bile salts and all of that. I won't recap everything, but basically we're going to see from all of this downstream metabolic consequences. We're going to see insulin resistance go up, lipid dysregulation go up, GLP-1 activity go down, so our natural GLP-1, and altered immune tone and increased systemic inflammation, not least of which is because of the microbiome changes.
So probably come out with a HRT that includes a GLP-1 now.
I would be so surprised if they don't.
Yeah.
Okay, is this why some Asian countries, the women don't experience as much menopausal symptoms because their diet's already anti-inflammatory?
Well,
maybe it's mitigating the estrogen issues?
Also phytoestrogens.
Okay,
Eating
the soy, which I
literally, yes,
you
you
do. All of us love soy.
I do love soy.
I love
tofu.
soy.
Who doesn't love tofu?
Can I just tell you guys how I'm making it right now, which is my favorite?
You're still freezing it?
Yes, so I absolutely buy tofu and freeze it immediately.
In the box?
In the box.
You don't open it first?
No. I keep it in the box. I buy my from Costco organic tofu, put it directly into my chest freezer, right? If I'm going to have tofu
in the plastic?
In everything. It's in there. If I'm going to have tofu that night, I pull it out in the morning so it can thaw.
Leave it on the counter?
Leave it on the counter to thaw.
In the box?
In the box.
Okay.
Yeah.
I need very specific instructions.
Still in the box.
Given my very rare cooking.
When I'm about to start going, I put a plate on the bottom, a plate on the top of it, and my
smush it
to get the water out.
Yeah.
Cube it.
How long do you smush it?
I mean, as long as I have, anywhere from 10 minutes to 3 hours.
Do you put it on top of a colander so the water drains?
No,
or just let it drain on the plate? Okay.
I put a towel.
Okay.
Oh, yeah.
Like a dish towel.
I'm lazy.
Okay, plate,
and then very big, heavy pot, right? 10 minutes of smushing.
That's
it? And then I cube it.
Yeah.
Oil, salt, in a 400-degree oven for 15 minutes.
That's it?
It tastes like it's fried.
Oh.
It tastes like
told
it's fried.
me that.
It is so, just salt and oil.
Yeah, it's good stuff.
My friend had a recipe we made with, you put cornstarch, soy sauce, olive oil, salt,
Oh, yeah.
And
It's
the
like a Chinese
cornstarch gives it a
restaurant.
little bit of a, and then you bake it in the oven. It was very good.
Ooh, you bake
I'm too
it.
lazy to, we just cut it up and eat it in the food.
I mean,
But it's much better that way.
It is better.
because I do prefer the way fried tofu tastes,
Yeah.
but I
Yeah.
don't
Tastes a lot
like the
better.
frying.
Yeah, the
Yeah.
texture totally changes if you freeze it. I didn't know you could freeze the whole block.
Yeah,
though.
just freeze the block.
Okay.
I always had to cut it,
I'm
and
gonna
then I
have to
got too
write it
lazy
down.
to do
No.
that and
Oh,
freeze
by
it.
the way, your Instant Pot beans timing worked. What it would have taken us years to come up with the timing. I just had to.
Really, guys, we don't have a lot of
I mean,
hobbies.
To figure out how long to cook beans in an Instant
Uh-huh.
Pot can be like a several-month process.
I don't
and you
even
don't have,
think I've tried. Have you tried
45
Googling
minutes.
it?
you said 40.
40 to 45 minutes.
We soak it, drain it, and then. But we tried on the online. There's like 50 different
yeah,
options.
that's really true. That's
So
really
anyway,
true. And it
thank you.
depends
Yeah.
on the bean.
This is black beans.
It does
40
depend on
minutes
the-
Instant Pot
Yeah.
after soaking. Okay.
Okay, so soy
Has good fiber.
Okay.
has phytoestrogens that will bind to the gallbladder and actually help with this.
Huh.
So in perimenopause, it can help to sort of maintain, and obviously postmenopausally, it can help to maintain.
Okay, so we keep eating tofu.
yeah,
So
just
good.
get organic.
Yeah.
Because organic,
In this country,
yeah.
at least in this country, yeah. Okay, progesterone,
Okay.
way lesser extent, but it does have effects on the gallbladder. So it specifically motility.
Slows it down.
Motility.
Yeah,
Yeah, just progesterone. That's what
obviously,
it
yeah.
does. Yeah.
Progesterone,
But you
anyone-
can do it non-oral if you for the
Totally. And that's
Yeah.
one thing that, the vaginal progesterone isn't it's not like first line recommended for endometrial protection in menopause hormone therapy, but we are finding more and more data support that, and you can do it. You can do
It's
it.
an
and
option
still-
if you don't tolerate the oral,
exactly.
I think, right?
Try the oral. You're not going to get the sleep benefits.
Yeah, you
But
don't
will
get
it
the sleep
protect your
benefits.
uterus from the
I
estrogen?
thought it
That's
was
what I
in
was
the
just
last
saying.
menopause
Yeah.
boot camp.
Yep. They are saying that you can do it now.
Wow.
Yeah.
Really?
Yeah.
And 100 milligrams?
We'll have to fact check.
I think I have
but
a dose in here.
Yeah, I feel like that's what was
Whoa,
reviewed at
that's
the last
Yeah.
time I went.
Yeah, that it's newer. You want to try the oral first because our data isn't as robust, but more and more
Yeah, because
pointing
there are
to
some women who hate the way progesterone
Yeah.
makes them feel.
yeah, but you need
Yeah.
it. And then the alternative is an IUD.
Right.
You can get a hormonal IUD, but that's
Yeah.
not for everyone either.
It's like
So-
a magic sleeping pill at the low dose you
Yeah.
had told me about.
Yeah, I know.
Says the woman who literally does not need any magic in her
But I
sleeping.
needed some
Also
slight
rub it in.
support. 25 milligrams. No one besides Dr. Sand would have known to tell me this.
Yeah, it's true.
And it's a
I
neurosteroid.
need to get
It's
you a
great.
present, actually. Sorry, go ahead.
Because it was
I
that
take
helpful.
presents.
Get her
Of
Indian
course.
food. Have your
Have
husband
cat
make
food.
her Indian food.
I also like butter.
It would be easier for me to deliver butter than Indian food. Okay, go ahead. I
I'll take
should
it
get
all.
you a present, though. It was very helpful.
I love helping people sleep. And I am still among the worst sleepers.
You are the
In the
worst
world.
sleeper.
But I do, it's like my pregnancies were awful. My sleep is bad, but now I have all the tools.
True. You definitely have a little too.
Like it makes you shop for all the tools. So
Oh, yeah, you did have to shop quite a bit.
I'm on a good regimen right now.
are you?
Yeah, we'll see. Because I'm perimenopausal, I'm on glycine and taurine and inositol in my sleepy time adaptogenic tea.
That's
And
it.
then now I just put in like a phosphatidylserine
Yeah.
with like some other herbs in there, a polyproduct. It's
Those are
really
all great for the gallbladder.
Okay, well, Dr. Sand told us about there's an herbal blend, which I guess we don't say names usually, but the herbal blend plus the low-dose progesterone
yeah.
is like magic.
Yep.
It's it's another 3 years of everything normal. So I
Amazing.
really need to get you a present.
okay.
This was an unofficial consult
I'm
on
gonna
it.
remember
You probably
this.
just told us about it one day, I feel like.
Yeah, I don't even remember it honestly.
Oh, I
but
remember.
it's-
I need to, I was like, I need to
Sounds like
thank
something.
her.
Okay, so progesterone.
Okay.
Either
Progesterone directly affects biliary motility. That's sort of the thing here. It's not as
Directly
impactful.
slows.
Yep.
Okay.
So biliary stasis is what you want to think about with progesterone, and obviously oral because of that first pass. So if we give it other routes, is like transdermal, which is super irregular.
Yeah, we're
and
not supposed to do that
generally
for
not
endometrial
recommended.
protection.
Vaginal, you're obviously going to bypass the liver first
Yeah.
pass, and it's not going to have as big of
and
an
is it
effect.
every day?
For vaginal?
Yeah.
I think I'm
Yeah.
vaguely remembering it's at least 14 days, but I don't remember. We have the protocol from the last
That's
time we
also
attended.
difficult with compliance.
Yeah, that will be
Yeah,
more
but if you're
difficult.
like feeling miserable
Yeah,
from
totally,
oral,
totally.
but you feel
Yeah,
amazing with the
totally.
estrogen.
right, you
Nope,
need to
whatever.
have to take it.
So my follow-up questions for this for this topic were like parse apart the progestin, oral micronized progesterone, Is there a dose dependent thing? If we do cyclical dosing versus continuous dosing, is there a difference? And yeah, it's sort of like all the obvious. The higher the dose, the more likely you're going to have an effect on the gallbladder. But it's mainly estrogen that causes this. So I don't want to like give the illusion that progesterone is really going to cause a lot of issues. Like if you're doing 300 milligrams,
that's a big dose,
or 300 milligrams a couple times a day, which they actually use for like traumatic brain injury because it's a neurosteroid, things like that. Then like watch out for those patients. But lower doses, obviously. The way this kind of informed me, and the IUD pretty well isn't going to do a ton, although progestins have more of an effect than progesterone.
That makes sense.
Those are synthetic progesterones.
Yeah, and that is what is on an IUD for hormonal IUDs. Yeah. And obviously the Mirena is the most. So for very sensitive people, if people are having a bunch of gallbladder issues and they have a Mirena and they've had issues ever since they had a Mirena, maybe think about that, but we don't need to think about it more than that. So the route of estrogen matters the most of anything. Maybe consider progesterone, beyond that. Okay. So let me just make sure. Yeah. It's basically what I typed out about the IUD is patients who have a progestin IUD who have right upper quadrant discomfort, fat intolerance, and bloating. That's when it should be on your radar. Okay. So I wanted to like do a little segment here on how this changed my practice specifically. Yes, that sounds exciting. And we can kind of wrap a lot of that up, but I do gallbladder intakes. I have a whole gallbladder intake because I see so many perimenopausal. Yes. It's a series. I mean, I've got my gut one that I'm sure we all have our gut history, antibiotics, infectious history, all of that. I now, for perimenopausal people and menopausal people, do gallbladder questions for them that, especially if people have had their gallbladder taken out. I don't just let that one slide anymore. We talk about that. When a peri or menopausal patient presents with bloating, fat intolerance, fat-soluble vitamin deficiencies, or loose stools, that's a lot of things here. And again, in Oregon, we have a lot of vitamin D deficiency. So, we got to be thinking about that. But now I'm thinking gallbladder function, not just the impact on the intestines.
Yeah, totally.
Because we think a lot about the intestines and sequestering bile and doing all of that. But I also am now going to be thinking about how hormones and antioxidants and all of that, progesterone, drugs they're on, are actually impacting the gallbladder from doing its job appropriately if they have one. Or if they don't, the biliary tree, whatever's left of that. I'm also considering this more in my oral versus transdermal estrogen conversation. So obviously, like part of my HRT screening or MHT screening for people was like, do you have a history of gallbladder disease? But a lot of people might not know that. They may have just been diagnosed with IBS-D.
That's part of your HRT screening?
Asking about gallbladder disease? Yeah. It was a contraindication.
You too?
No, I have never thought of it this much. This is like my first exposure to something this deep.
It was a contraindication to oral?
Yeah, I
maybe that's why I've never ordered oral.
Now, but so oral estrogen, even bioidentical oral estrogen, not just like the old types, conjugated equine versions, increases your risk of stones.
Okay, and then OCPs as well?
Yeah.
Okay.
Combined oral contraceptives, yes. So you want to, if someone has a history, I'm not going to put them on oral estrogen.
That makes sense.
If they have active gallstones or active gallbladder disease, I'm not going to put them on oral estrogens.
I guess I've never prescribed the oral, so maybe that's why.
Yeah,
I guess that's why I ask.
The patch, or the, cream options, the gel options. Okay. Yeah.
So just so we're clear, I think we're going to have to be paying attention to this because right now there is such a shortage of patches. Yeah. Yep. I mean, it's a huge deal. Like, thanks to social media, every woman starting at like 38 thinks she needs to be on a hormonal patch.
Yep. Yeah.
They were not ready for that. So we've got 2 years of
backlog.
We're going to have to start looking at oral estrogens.
Yeah. I mean, oral, they work well for a lot of people. And even if just temporarily, they're not a problem, but we have this population that is more predisposed to gallbladder issues.
Or
oral can exacerbate.
Yep.
And oral works. It's great. It's just,
it might be the only thing you can get.
I don't know if it's great.
Well, you can also get the gels.
The gels. I mean, I feel very comfortable compounding up topical estrogens.
Yep.
But make no mistake, they're not as reliable as the patches.
No.
And I think that's, so what I'm doing with my patients, I'm going from twice a week to once a week. So smaller patch to bigger patch. And if that doesn't work, I'm going to go to creams, but creams are more expensive.
Yep. Is it that hard to get the patches right now?
Yes, it is that hard to get the patches right now.
And I have a lot of patients with skin. I see a ton of histamine people.
Yeah.
So there are workarounds. You can do like a steroid cream or something to help.
Or Flonase. You can spray Flonase right before you put on a patch.
Or there is a prescription. Isn't there a prescription cream, another formulation that's a prescription or no? I can't remember.
Triamcinolone?
No, for the estrogen.
Oh,
Or is it only
there's a gel.
Gel.
Yeah, I think there's a gel, right?
Gel.
Okay.
Yeah, and then there's, my nurse practitioners playing around with vaginal, the E-rings.
Yeah.
So we have
there's other
options, but we definitely need to be thinking oral.
Yep.
We need to be thinking oral.
Yep.
Also.
And be thinking about their poor gallbladders in
Gallbladder.
there, because this is a thing. I also think about the estrobolome differently.
Ooh,
so
I
that
love
was
the
another
estrobolome.
point here. When patients have estrogen dominant symptoms, which is a term people love to hate, relative estrogen dominance, or however you want to say it, and they have whatever we want to term that, and GI dysbiosis, I'm looking at those as one system, which, is sort of the estrobolome, but not two separate systems. So I do have a little bit of information, if I can find it in here. Oh, it's in our treatment section. Sorry. Next episode on DIM and calcium D-glucarate, which we love and know for estrogen clearance and all of that. But why for the gallbladder, they're really helpful.
Don't know.
Yeah, we're going to get there in the next episode because we're running out of time. We're running out of time, but that's another thing that was like, wow, mind blowing. Also, the oral micronized progesterone gallbladder conversation, if they're really at risk, I may just have that on my radar more than I did before based on this information.
Yeah.
And maybe most impactful is menopause equals a withdrawal of the gallbladder's antioxidant protection. So menopausal people deserve more antioxidant support than we're giving them. There's so many routes in for that, but this is huge. And if they want to keep their gallbladder for the rest of their life and have their biliary liver system working well, we need to be supplementing with either estrogen and or antioxidants.
Okay. Should we do a review?
Yeah, let's do a review.
Okay, so basically the biggest issue with estrogen is with hormones in the gallbladder is the estrogen component of it. If your estrogen is too low or if your estrogen is too high, that is problematic. If your estrogen is just right, that is protective. And then not only that, but also those spikes that we see again and again in the perimenopausal state causes more problems than before. And so basically that's the take home is estrogen and the gallbladder are basically two extensions of the same organ. The other piece of that is there is a progesterone component. The progesterone component will slow motility of the gallbladder just like it slows motility of everything else that we have. It has less of an effect on the gallbladder, but it still has some. And then...
So for very susceptible people, we need to be having progesterone on our radar.
And then really, if we're talking about HRT and we're especially talking about oral HRT, then we need to be screening because you end up losing a lot of that protection. And then the last thing...
I think that was it.
Yeah.
That was it?
Good. That was a lot of stuff.
But that was a lot. I just
have to listen again and read the transcript.
I know, these are really hefty. So our next episode, we will be talking about various treatments for all of these sections with the gallbladder and our favorite naturopathic functional tips. Stay tuned.
Thank you.
Thanks for joining us today. Stay tuned. We release episodes every 2 weeks.
If you like this episode, please subscribe and don't forget to rate and review us to help spread the Turd Nerd word. Eee!